GCSMR. Thank you. Welcome to GCSMR webinar this month. Thanks for joining this Sunday morning. I know everyone is busy during weekends, so let me thank everyone for joining this session today. My name is Sandamari Prabhakar, known as Tamarai. I'm in Charlotte, North Carolina. I'm the secretary of GCSMR, that is Global Center for Siddha Medicine and Research. This is a non-profit organization that is registered in the state of North Carolina, and it's a 501c3 organization. Already you all know about Siddha Medicine, I think, it's one of the oldest medical system from southern India. So the main goal for our organization is to scientifically take this Siddha medicine system around the globe, as it is one of the very oldest and very good medical system. Following me, Dr. Rama Jayabalan from Duke University. She will give an intro about why this meeting is about, what is the GCSMR doing, and what are our activities so far. This session is mainly about Varma Therapy online course. I hope most of you are following this GCSMR's activities all these years. And we have been posting a lot of messages about this Varma therapy online courses that's been conducted from the Manipal University by Dr. Arul Amuthan. So this is a deep session to give you a deep understanding about what this Varma course is and how this works, and how can you benefit from this course, because we have worked a lot, particularly Dr. Arul Amuthan and the team of doctors have worked and put a lot of time behind this to bring this Varma therapy in this very good university, Manipal University. And we are working towards that to benefit all the other people who are in the medical field, and who are caregivers and healthcare professionals who can take this course and benefit to their for their professions. Dr. Arul Amuthan will talk not about that. Now I am giving the meeting to Dr. Rama Jayabalan. She will tell us the activities of GCSMR quickly and give an intro about our organization. Thank you.
Vanakkam and greetings to everyone. I think it's night for everyone from India, and those of you who have joined from US, good morning. Thank you very much for joining. My name is Ramamani Jayabalan. I am a research scientist at Duke University, Durham, North Carolina. I've been in the research field for 30 years. So as a true researcher, I'm happy that and honored that I'm part of GCSMR to take the global, to take the Siddha medicine globally. I really will recommend that everyone follow our page. I'm sharing our website here. So please visit our website. And our website has got a wealth of information. You can get a lot of recipes, a lot of information about Siddha. Even those who don't know Siddha will get a wealth of knowledge from our website. So we have everything here, right from publications, media, events, what we conducted previously. And you can see who are all we are affiliated with. So with Mahe Moorhead School of Medicine here in Atlanta, USA. So I would like to give small information about what's going on in GCSMR. So the Global Center of Siddha Medicine and Research, the main aim is to promote ancient Siddha medicine food and rejuvenation practices worldwide. And we are so happy that our organization is operating along with MAHE. As an initial step, we are trying to establish a Center of Advanced Research in Siddha Varma and Integrative Medicine at Manipal Academy of Higher Education in Karnataka. And also as a next step, or I would say even a great milestone, that we, our doctors, along with who are working in GCSMR, has announced an affiliation with Moorhouse School of Medicine, marking a significant milestone for our entity. This collaboration opens up several new avenues and opportunities for both our organization and a lot of aspiring medical professionals who want to pursue integrative approach of medical practice. And most importantly, I would like to share that, and I'm really proud that GCSMR has published its first forever book in Tamil. It is in Tamil right now, but we are working on publishing it in English and other languages. So please bear with us. But this right now, this book is in Tamil. This is called a Siddha Maruthuva Paichi Kaiyed. And it's mainly for all the professionals, medical professionals, that will really benefit from this publication. And I'm also proud to say that we published a Kannada Siddha book, and it was written by Vaidya Narasimha Swami Bharatwaj. And this is the first Kannada Siddha book. I think it's entitled as Arogya Jeev. Pardon me if I'm pronouncing it wrong, because this is in Kannada. Arogya Jeevanakke Agastya Siddha Vaidya Padahati. Pardon me again if I'm pronouncing it wrong. And this will also be really, it was recently published, and it will benefit all the medical professionals and even those who are interested in knowing about Siddha. So now without further ado, I will hand over the stage to Dr. Arul Amuthan, who's going to give you a wealth of information about Varma therapy. And he has worked extremely hard to come up with a great course at Manipal University. And GCSMR is proud to be part of this Varma therapy course. Thank you very much. Now Dr. Arul Amuthan will take up the stage.
Okay, thank you, Rama Mani Madam. So, Vanakkam, very good morning to the US audience and good evening to the Indian audience. So, today the session is about the traditional Siddha medicine, Varma therapy, and the courses available at Manipal University. So, Siddha system of medicine uses wide variety of therapies like herbals, minerals, and other animal-based products, and also manipulation therapies. In that, the Varma therapy is one of the unique therapy which is practiced by the Siddha physicians. So the Agastya is the father of traditional Siddha medicine. I call it as TSM, that describe 1008 vital points in the human body. So there are more than 120 TSM literature available in Tamil exclusively to describe these vital points application. And all these literature call these points as a Varma points. So the Varma term derived from the terminology Vanma. Vanma mean in Tamil it's a Palivangadal, taking revenge, giving back. So it is nothing but the reflexology. So if these vital points are triggered or stimulated at a particular pressure, it will give the reflex action. So that is the simple meaning of Varma. So the Varma derived from the Vanma. Siddha Varma therapy or medical Varmology is a branch of TSM that deals the manipulation of these vital points to cure the diseases. So till now the Varma therapy is taught as a Guru Parampara or as a secret science. So there is no universities are offering courses to learn this Varma therapy for the healthcare providers. So you should understand a little bit about the fundamentals of Varma. If you look at the embryological concept, when the baby forms in the uterus, so it will fold. Actually, initially it will be a flat cell arrangements, then it will fold to form the organs. So when the embryo folds, then there are many junctions are formed. So these junctions will have lot of vital connections with the many internal organs. So the Varma points are arranged in this vital embryonic folding. For example, this is the one Varma point called Shulumunai Adangal, which is located in this area. So this is the junction of left upper lip, right upper lip, and nose tip. But embryologically, if you see, this part has the connection with many other internal organs and other parts of the scalp or the head. So this is how, by manipulating this one point, we can give the effect. We can give some physiological or beneficial effect to other parts of the scalp or internal organs. So this is how there are 1008 points described in the Siddha literature. Another concept is there are 12 nadis or energy channels, meridian channels, and the energy which flows along the 12 nadi, which we call it as a Vasi or Vachi energy. So there are 12 nadis and 12 Vasi energy pathways are there in the body. So each nadi starts from one part of the body and it travels along the internal organ, external organ, and finally ends in an external orifices. So we all know there are 9 openings in the body. Right eye, right nostril, left nostril, genitals, mouth, like that. So again, there are 2 internal orifices within the mouth, upper pharynx and lower pharynx. So in this area, there are other minute points are there. So 12 nadis are linked with the 12 orifices, and they all connected with an internal vital organ. So this is how the manipulation of these nadi can be reflected in the internal organ. So all these Varma points are arranged or located along these channels. So if you give some pressure, mild pressure, you can exert some kind of effect. If you give little more pressure, you will exert some kind of effect. So this is how all these points will be producing pressure dependent effect. So that effect may be beneficial, may be harmful. So after knowing detailed about all the pressure dependent effects of all the points, one can use this for the benefit of the patient management. There are special points called Adangal points. So Adangal points are very highly energetic points. They will be highly useful for the therapeutic purpose. So the Varma points, few of the Varma points are called Adangal point, and there are exclusively Adangal points. They never harm the body. They will do only therapeutic benefit. They will exhibit only therapeutic benefit to the human being. So we will be using these kind of Adangal points for treating most of the diseases. So there are separate techniques are there to stimulate or to manipulate these Adangal points. So we call it as a Ilakku Murai, Amartal Murai. So there are many more manipulation techniques are available. And you know that there are 6 Adhara chakras or six Adharam or Adhara chakras are there in the body. So even any diseases that can lead to the abnormality in the Adharam. So that on the other hand, any abnormality in the Adharam will affect the respective internal organs. Now, using the Varma manipulation, one can correct the Adhara chakra's energy level. Again, the concept is yoga practice, asanam, meditation, chanting methods, the Silambatam, or even Bharatanatyam, classical dances. They are nothing but the self-stimulation methods of these Varma points. So, the concept is the Varma points can be applied by the physician to the patient, whereas these kind of self-practicing methods can lead to the self-stimulation of these Varma points for the preventive care. So again, one more important concept is there, Varma Pinnal Murai, which means the manipulation of each nadis separately. So if we identify that this person is having a disease now because of the imbalance or defect in the Idagalai or Pingalai or particular nadi, then we can manipulate only that nadi after knowing its origin, its course, how it goes, where it goes, and where it ends. So along these channel, vital points are there. So those channel can be manipulated by feather touch method, not by deep pressure, justified by feather touch manipulation by the method, which is called a pinnal murai. So it is actually very useful in the manipulation of psychiatric conditions. Again, any traumatic consequences, mild trauma leads to the skin injuries or skin wound or ulcer formation. Strong injuries leads to muscle ligament and nerve injuries, even fracture dislocation. All these are actually fall under this Varmam therapy. So any fracture management, dislocation management, post-traumatic management, post-surgical management, sports therapy, these all actually managed by using Varma therapies. So this is commonly now applicable for post-traumatic surgical rehabilitation and sports injuries area we are now applying. Even idiopathic diseases currently available, but we don't know why the disease came. Suppose a patient is very healthy in the younger age, he developed asthma recently. The reason is not known. There is no allergic or no family history, recent onset. But if you take a clear history, there must be some trauma on some of the Varma points related to asthma. So even trauma today, what happened can induce the disease, can develop a disease over a period of time. That can be immediately, maybe after 1 month or even after 10 years, people develop the other what non-traumatic condition. I mean, if the trauma is on the skeletal, on the outside the body, on the Varma point, but the disease develop in the internal organ. So these kind of things, idiopathic diseases are explained in the Varma therapy, and these can be diagnosed by Varma nadi diagnosis. So we use that and identify if there is any trauma as a cause for the condition. So this is a spinal disc related problem, asthma, some kind of infertility. So many diseases actually not related to orthopedic but related to internal organs, we are able to diagnose and treat using the Varma therapy. So there are three different body are there in as per the Siddha medicine. So the Paru-udal, Karana-udal and subtle body. So the physical body, what we know, what we see, and the psychological or mental body, what operates the physical body, and the subtle body or the energy body that is operating both the physical and the mental body. So diseases can occur in any of these three bodies. So all the three bodies, diseases can be diagnosed and treated by the Varma therapy. That is the special concept of the Varma therapy. And suppose if you treat the patient at the physical level and not treated in the mental level or in the sukuma level or energy level, so the disease will again and again come, appear back. So only if you treat all the three bodies, then we can offer the complete health for the human being. That is done by Varmam therapy. So all the benefits of yogam, pranayamam, meditation can be 100% given by Siddha Varmam therapy. The only difference is the Varmam, yogam, pranayama, meditations are self-practiced or the self-stimulation methods, whereas the Varmam is the manipulation of Varma points by the physician to the patient. So here some advantages there, even for the kids, bedridden patients, unconscious patients, uncooperative patients, or physically mentally challenged patients or psychiatric patients who cannot perform or don't cooperate to perform this asana meditation. There we can give the expected effect through the Varmam therapy. That is the added advantage of Varmam therapy. Again, there are many methods are there to manipulate these Varma points. It's not always the physician fingers. We use many type of small wooden devices, ancient devices, and some of the seeds there are many seeds are there, different size and shape seeds which are placed on the Varma point, and given the pressure is given to cure the diseases. Even copper coins are used. Copper coins are placed on the Varma point, and we apply plaster or we apply bandage, and it gives some kind of pressure on that. Patient is also advised to give the pressure themselves frequently, so that the pain management can be done. Similarly, these kind of coconut shell, the coconut shell based ring, these are also used to manipulate the Varma points. Apart from the physical stimulation, there are other form of stimulation is also available, like heat stimulation. So here we use many herbal pack or root, like for example turmeric root. It is used to convey the heat to the Varma point. So this is one type of stimulation. It is in Chinese medicine. It is used like they call it as a moxibustion. So same application is there in Siddha on the Varma points. Similarly, Shuttige is there, like using metal rods, heated rods. We create a heavy heat, and we just expose the Varma points with the heat here, constant and heavy heat, so that many diseases like migraine and other joint pain, back pain, these are very successfully we are treating. Again, heat application using hot stones also we are applying. Again, the another therapy is actually, you are well aware about cupping therapy or hijama therapy. It is very much popular. It is very much used in the traditional Chinese medicine. Same therapy is there in the Siddha, in the Varmam therapy. So it is called as a Kombu Urunjal. Kombu Urunjal means cupping using horn. So ancient days they used the horn to for the cupping to create a negative pressure inside. So nowadays we are not using horn. We are using either the stainless, like this, like chombu or vessel, or the glass glass based cupping devices. So here the inside the using the methanol or other any heat source, we expose the heat inside this horn or this cup or the glass apparatus, so that the oxygen is used, oxygen is spent because of the heat. Then we directly place this apparatus on the specific Varma points, especially on the back and abdomen for some kind of diseases. So there immediately, once the heat is over, there is a negative pressure developed within this cavity, so that pulls the skin and muscles. So basically we are pulling the Varma points here. So it is also one type of stimulation for the on the Varma points. And we are also using oil, like we can use the oil to stimulate the Varma points for a longer period. For example, Ennai Talam is a one concept where the oil is applied in the cotton or in some other one space is created, and oil is applied and stagnated. So the Varma points is in a point is now exposed to the medicated oil, and that medicated oil will have a lot of different herbal ingredients. And again, there are different kind of potencies are there. So cool potency, extreme hot potency, mid potency, like that. So based on the condition, we can use this oil. This is also very much useful. For example, if a patient is having migraine headache, another patient is having sinusitis headache. So both are headache, but still based on the migraine headache or sinus headache or tension headache, we can choose 3 different oils. So whichever is suitable, we can ask the patient to follow this Ennai Talam. So it is actually very good therapy. Again, the Sanagam is nothing but the oil stagnation. So Ayurveda, it is very popular, and similar therapies used in the Varmam therapy. So here again, few Varma points are there in this important point. So in the disc bulging, disc prolapse, in these cases, we stagnate the medicated oil in the affected area and in the Varma point. So this is called Sanagam or Puravalayam. Again, Dara is another important Varma application, where the Varma point is continuously stimulated by drop by dropping of oil or any medicated liquids or water-based liquids or oil-based liquids. So this is again very much important. In this picture, you are seeing for the migraine, insomnia or chronic headache patients, they will receive this Dare on the Bala Varma, which is located in the in the neti, in the frontal headache, in the frontal head area. So that is the important point that you can stimulate by one finger, or we will teach the patients to use to stimulate that point with their own hand. But if you want to stimulate for 30 minutes or 1 hour, best way is using the dari. So this is how the Varma points are stimulated by various methods. And these are not internal medicine, these are external medications only, external applications. So they are harmless to the people. And again, bundle heat application. So here there are many Varma points. This is the frozen shoulder patient. So around the shoulder there are few Varma points that has to be manipulated. So what we do, so we pack the herbals and other oils, in this bundle. It is called a kili or potalam. So this bundle is again dipped into the heat oil, and again, so oil plus heat plus the medicine bundle in the herbal bundle, all three together will work on the Varma point along with the pressure. So here it's a multiple application of the Varma point. So this is a little superior than the finger press alone. So this is called the Ottadam, okay, Kili Ottadam. So this is also very much useful. Similarly, apart from the Varma stimulation, there are other external therapies also practiced in the Varma therapy, like application of herbal paste on the affected area, and application of the herbal paste on the scalp. This is called talam or tapalam. For 1 hour or 2 hours, it has to be applied, then it has to be washed. So there are specific herbal paste is available for migraine, for trauma headache due to traumatic headache, or for the sinusitis, insomnia. There are different herbal pastes are available that we will be using. Similarly, herbal bandages and all belong to the Siddha Varma therapy. Again, this is another very interesting therapy, Varmasanam. Actually, Neetchi Tadaval is a one terminology we use for the Varmasanam. So here what happened? Patient is asked to perform certain asana for here back pain, for example, back pain and neck pain. And physician also apply Varmam. When patient is performing asana, Varmam is applied. So this Varmasana combined practice is having added synergistic advantage than yoga practicing alone. So this is very important in Siddha. So it is a Nietzsche Tadaval, and we named it as a Varmasana. Similarly, Varma meditation is there. We all know, we all meditate. When meditate, we just imagine the nasal orifice, or some people will imagine the point in between eyebrow. These are Varma points. Apart from what else we can do, there are 1008 points in the body. So based on the necessity, you can meditate. You can focus on the point, whichever necessary during the meditation to use the effect. Suppose if the person is having some reproductive dysfunction, and there are Varma points related to reproductive dysfunction. So those points we will teach to the patients, and they have to meditate to the point. So the stimulation of the Varma points through the self meditation, okay, that is called Varma meditation. And Nettivangal, it is like a chiropractic. So in USA, you know about chiropractic. Same way in Siddha, each and every joint has to be aligned, or has to be manipulated for the well-being and for the preventive care, and even in the pain management we practice. So in this patient, the spine twisting is done. So when similar thing is done in the yoga also, they do spine twisting, but it is very difficult. Some patient, they cannot, obese people, they cannot do the twisting, or if there is acute pain, they cannot do. But when we do, when the physician is practicing to the patient this twisting, it will be easy, and we know the trick how to do that, and what extent to twist, and for a particular disease and all. There are different techniques, and that need in-depth practical session to train the student to learn it. So this chiropractic technique also very much useful in the Varmam therapy. And there are other hypnotic and other kind of no Varmam. These are available. So of course, very less people practice these therapies now. And if you know, till now I told there are 1008 points. So in some disease, we can stimulate only 5 points. Some disease single point stimulation is enough. In some disease we need to stimulate 20 points. So when we want to stimulate 20 points, there must be some kind of the fashion how to stimulate, which is 0.1, 0.2, 0.3, 0.4. So it is similar to the pulley column. So people keep the dots and they will connecting the dot. That leads to the very beautiful pulley column or the rangoli. Same technology only is called Varma Tadaval. So if you want to stimulate 20 points in the head, so we cannot stimulate one by one. So one by one, if you connect, that will give the specific Varma massage. So it is called Varma Tadaval. And there are different different application of Varma Tadaval. Even to stimulate the Varma points in the scalp or in the head, there are number of Varma Tadaval. So some people will go from up to down, then down to up, or left to right, right to left. So like that, there are different, like in the pulley column, how you get different picture if you do connect different points. Same way, this Varma Tadaval also very unique Tadaval we use for our patients based on the necessity. And this is another one, Sarvanga Tadaval or Eganta Tadaval. Here, the all the Varma points from the head to toe are stimulated in the Tadaval or in the continuous massage fashion. So here this massage takes definitely 1.5 hours. So this is useful for the rejuvenation or the wellness centers to make the energy to flow in a right way in the all the through all the 12 channels. So this is also very unique therapy here. Apart from that, leech therapy, it's using Hirido medicinalis, steam therapy, nasal drops. These all other external therapies, which is practiced in the Siddha Varmam therapy. So these all collectively we call it as a Siddha Varmam therapy. Here no oral medications are involved, only external applications and manipulation. So with this itself you can do a lot of clinical management and wellness trainings we can do, and people get lot of benefits. Some people, if they prefer oral medication, we give oral Siddha Varma medicine. That's another thing. And there are, apart from the India, even Malaysia also, this Varmam therapy, the finger manipulation and the external therapy, it is approved. So we all should know that beyond the India, this therapy is also approved, and the book is released by the Malaysian government. This book is freely available. You can download from the Malaysian government website. So now we have this much wealth of knowledge and practice, but there was no attempt to popularize and globalize this knowledge and to teach or to train many people. So the GCSMR, which is the NGO actually who are actually organizing this talk, and they have come to Manipal, and we have made a MOU with Mahe to establish a Siddha chair, and as a result, we established the division of Siddha and its OPD, and the courses also we have started. Now we have the specialty Integrative Siddha Medicine OPD. So here we are with the collaboration with the National Institute of Siddha. We are focusing some 8 conditions where integrative approach is given. So at present, we are offering the following courses. So postgraduate certificate course in Siddha Varmam therapy. It is available in 2 modes, full-time mode and hybrid mode. I will explain in the next slide. Then introductory certificate course in Siddha Varmam therapy. So the first course is 6 months or 1 year, which is only for the healthcare professionals. Because after this training and knowledge, they can practice in the patient. The second course is only introductory course. It is for the self-knowledge. It is not for the public people to practice. So because it gives good idea and some kind of knowledge for the self and family practice, it is open for the publics. And the third is the elective course on traditional Siddha medicine. It is the 1 month course, but it is only for the medical students of USA and Canada. And fourth is the PhD and postdoctoral fellowship in Manipal. So the idea of the Siddha Varma therapy course, it started from 2017 when I attended a FETNA meeting at Minneapolis. The Dr. Janaki Raman, he conducted a session on Harvard Tamil chair. So I attended that. Then I thought, why can't we have a Siddha chair? Then I got the opportunity to discuss this idea with him after so many years through GCSMR. The moment I told this idea, then he asked, what is the first step you want to do? First step should be a simple step, should be a possible step that should lead a great opening to the future. Then the idea came as a Varma therapy. This is the first step. Then immediately Dr. Janagiraman and his wife Mallika Janagiraman came to Manipal, met our Manipal officials, donated 10 lakh and asked to requested to start the Varma therapy. So immediately the work was done very sincerely. Syllabus was formed and approval was given by university. The Dr. Kannan Rajaram from Kanyakumari, who is the founder of Center for Varma Medicine and Research, he helped us a lot to develop this, the curriculum for us. And it is the first Varma therapy course for the health providers from the medical university. And so we are now happy to say that we have retrieved the Varma therapy techniques and protocols. Even Dr. Kannan Rajaram is helping a lot in preparing the Varma mannequins. So we are teaching with these mannequins to our students. So coming to the 6-month full-time course. So as I mentioned you, the postgraduate certificate course is meant for the people who have completed their undergraduate in the healthcare system, medicine, dental, Ayush like Siddha, Ayurveda, Naturopathy, Unani, even allied health sciences, physiotherapy, occupational therapy, any therapies like chiropractitioner, even BSc nursing or MSc yoga therapy, so or any other equivalent therapies from recognized institution. So when we started this course last year, the first batch itself we got 3 students. Now second batch we have called, the last date is till 20 February is there. Till 2 weeks is there to apply. So till now we got 7 students, and the happy news is all the 7 students are from 3 states, Tamil Nadu, Kerala and Karnataka. So now we are actually slowly starting the nationalization, and globalization also will be achieved through this course. So the last date is 20 February 2024. You can click this link, apply.manipal.eu, and there you can fill the detail and take the admission. The classes will be starting on next month, 1st March. So here, I already mentioned this is the unique class, and it's globally, it's the first time we are starting. So classes are taken by experienced Siddha Varma experts. So apart from the qualified Siddha doctors or who are working a permanent employee of Manipal, we are also planning to involve other Varma experts all over the India, from Tamil Nadu, Kerala, wherever they are, to bring them, and we are trying to gather all the information related to Varmam, and in future we will collect the whole Varma ideology in this department. So at present classes are taken by the experienced Siddha Varmam experts, and Varma mannequin based practical session. This is the first time, nobody else has done in India, and we are doing it. And hands-on experience to identify more than 300 Varma points. So this is very important. Some people will be very thin, some people are very short, some people are very obese. So we have to identify Varma points on their patient body. So we are giving adequate training in the mannequin and in the patients also to locate the therapeutic Varma points, and the manipulation, pressure dependent effect, how much pressure, how to give of all the therapeutic points. Similarly, they are attending clinical postings at a division of Siddha of Manipal. So they are getting very good, training, and they are very confident, and they are able to practice the day they completed. Next day itself, they are able to practice they are on their own. So Varma therapy protocol for common conditions, more than 40 conditions we are teaching. Siddha external therapies also, like I have shown the pictures, right? Leech therapy and other thing. So these are also included in the curriculum. So the external therapy or non-pharmacological part is actually collectively kept in this syllabus. After completing this course, one can integrate the Siddha Varma therapy on their own, along with their whatever stream of medicine they are practicing. Varma therapy treatment center they can run, and Varma Wellness Center can be definitely started for the preventive care, and the teaching and research also they can involve. Now, same courses also this year, because of the huge demand and request from the many private practitioners and doctors. So university agreed to start a same course but in the hybrid mode. So but the duration will be 1 year. So in the hybrid mode, what will happen? It is a 1 year every Wednesday, because mostly Wednesday people will be free other than weekends and week starting days. So the online classes, live online classes will be there. It will be a live class, interactive session will be there. And every alternate months, second Saturday and Sundays, they have to come to Manipal for the practical session. Because தொட்டு காட்டாத வித்தை சுட்டு போட்டாலும் வராது, which mean these kind of knowledge has to be located and demonstrated. This is a skill based training, so it requires a lot of intensive practical session. After that, there will be a records, there will be assignments, seminars, everything will be there. At the end of the course, 1 week compulsory internship at our hospital is must. So those who completed all the fulfillment only will be given the certificate. And for the travel, visa, local accommodation, food expenses are not included in the fees. So the fees is actually rupees 60,000. This is same for full-time and hybrid mode. Similarly, NRI category also, the fees is same for both hybrid mode and full-time. That is a USD $1,600. Here, NRI category, there are some instruction is there. If the NRI category, foreigner or Indian settled in abroad, they who are eligible, I mean, with the healthcare provider the degrees, basic degrees, can directly take part to the admission, and they will be given all, they will be obtained the student visa, everything. But in case of the hybrid mode, they cannot come and attend every alternate week. So university has given the relaxation of 2 weeks continuous contact program at the end of the course. So in that, all the practicals, 1 month, 1 week internship, everything will be completed. 2 weeks continuous contact program. If they require additional 1 more week, they can take part the internship. That's another thing. But for this 2 weeks or 3 weeks program, they may not get student visa. For that purpose, the idea is Indian origin people who are applying for this course, hybrid mode, they can get directly admission using the Indian passport. Whereas the foreign nationals, non-Indians from the abroad, they should produce one NOC, no objection certificate from the employer if they are working, or the institution if they are doing some post graduation, or somebody can sponsor, some hospital or some NGO, they can sponsor. Those letters are mandatory to take the admission. Otherwise, there is a visa issue. So considering that issue, so individual like private practitioners are not eligible to apply under the NRI category. Again, for this course, to February 28th, next this month, the full time is there to apply, and it will be started on March 1st onwards. Already people have applied from India, from Sri Lanka, Dubai, and there are few inquiries from Malaysia and USA. So definitely we have actually reached the globalization level. So, other courses like introductory certificate course in Siddha Varma therapy for the local people and for the local students, like it will be evening course. And for outside people, you have to come here 1 full month, you have to stay here. You will be attending theory, practicals, and small practical sessions, and you will be doing some kind of hospital observation, everything. So here anybody, any public can take part this course. So this is only for self practice, not for the commercial practice. That is very important. So here the fees is only 15,000 for Indians. General category for NRIs, it is $400. For this admission, you have to contact me and we will give the schedules. For the Manipal University students, we are giving this as a elective course for 3 credits, so as part of their curriculum. So this is again from students from abroad and other things. They are actually learning this. So again, globalization is actually indirectly happening. So another course is the elective course, 1 month, 3 credit course to medical students of America and Canada. This was initiated by Dr. Sridharan, who is here, the Sridharan Rajagopal sir, from the Morgan School of Medicine. And those who wants to take the admission, they have to contact him directly, and admission will be done at Morgan School of Medicine. And they will be deputed to Manipal and Health India Foundation, Chennai, for the training and teaching sessions. Finally, the students will be getting credits from the MSM. So from the Moro School of Medicine, other online courses and CMEs are under progress. So this is the good opportunity for medical students and other students in USA and Canada. They can take this elective course and get the credits that will be helpful to build their career. So you have to contact Dr. Sri Rajagopala Sridharan, and we will be giving this their contact details, whoever is wishing to contact them. So the goals which are on the pipeline. So till now I have discussed what are we have finished, and there are other things we would like to introduce you that which are on the pipeline. So international collaboration with the abroad medical institutions, complementary and alternative medicine institutions for joint courses or research or faculty student exchange joint PhD program. To this will help to get the global recognition to the traditional Siddha medicine, and Manipal is willing to to take any type of this kind of initiative. So in the audience, if somebody is having any of this thought, you can contact us. So we will work on that, and starting online course or certificate course for the public. So this is again another thought. Many people want to know Siddha dietetics or Siddha preventive care or Siddha women and child health. So this will be developed soon, and this year itself we will be starting this course, and annual scientific conference and workshops to disseminate the knowledge among the healthcare providers. So this also will be done in this year. And Manipal is also planning for senior resident program and fellowship programs for the Siddha doctors and allopathy doctors and healthcare providers to get trained in the Siddha medicine. So this will be worked out, and we will be announcing soon. And short courses on spoken Tamil and written Tamil. This is again, we felt in Manipal, we have many other language departments except Tamil. So through the Siddha department, this can be worked out. So this will be helpful for the people who wants to work on Siddha literature, because most of the literatures are in Tamil, and other works like collecting palm manuscripts and publishing books and translation. These all other ideas we have, and collecting the whole TSM knowledge and practice under one umbrella. So this is the idea, that if somebody wants to know something or want to refer a book, want to take a treatment, want to study, so everything should be available in under one umbrella, and we will be achieving it soon under Manipal Siddha chair. And other research areas we have already initiated, and many researches also will be there in future. And one library museum with the palm manuscript and e-version of books, everything. This is also another idea, so that the people from the globally, they can access and learn it. So these all done by the donations and supports from the publics and the GCSMR. In the last year, we got 35 lakhs donations and grants from the individuals, GCSMR and Root Industries Coimbatore. I thank them in this time. And also Manipal matched that and gave double the amount, not double, more than double, 90 lakhs. Manipal sanctioned as a matching fund for creating new OPDs, therapy rooms, IPDs and classrooms. We don't have IPD previously. Now this year we will have. And TMA by scholarship for the PhD candidates who are going to take Siddha topics. University is paying a scholarship. So this year, three candidates are going to take Siddha topics. And interview everything over, and students will be joining by next month. Scholarship is given for them from the Manipal as a matching fund. Again, a few more suggestions and requests to the people. We need more support, but support is not always donation. Even there are many other forms also. You can contribute supporting PhD students for their research. Many areas are there to be done. Short courses, to start the spoken written Tamil, we need some financial support. Siddha Museum Library, this also we need support. Again, to establish a full-fledged model Siddha hospital with inpatient facility. So if we have this facility, the idea is people, the Siddha doctors or allopathy doctors or healthcare providers, they can come and learn if they want to learn infertility area or cancer or orthopedic, they can just come and learn and go. So the facility will be ready for them. So we want to create that kind of, world-class facility for the learners and for the patients. And in Manipal, we are following integrative healthcare. So the idea is in the soon and the near future, we will have a Siddha and Integrative Medical College where the patients will be getting integrative treatment. Whichever treatment they need, they will be getting. And this is the idea. So this is my last slide. Manipal Siddha Chair aims to preserve our ancient health system, decode it scientifically, and give it back to our next generation. So with this this is my last slide. So people who wants to take the admission, you can definitely contact me. I will guide you, and you can share this knowledge, these courses to your friends and family people. That may be useful for them. Thank you. If you have any doubts, I am here to answer your question.
Thank you very much, Doctor. We truly appreciate all the information you shared. And now the floor is open for questions. And I saw Sivakumar Veluswamy. He raised his hand first, so he can ask his question. Thanks.
Yeah, thank you. Thanks, madam. Thank you, sir. It's very good informative session. Myself, Shivakumar Velusamy. I'm from Bhavani, Erode. Right now, I'm in California. My question is, two questions I have. Is this Varma therapy can cure autism kids? Because nowadays I see many of the kind of surrounded people in my area and socially. I see many people are affected. Many kids are affected in autism. Do you think is there a permanent cure possible in Varma therapy? If yes, the second question, is there any kind of training or anything can be used for only for autism related treatment or cure?
Okay, sir. Actually, the autism is a multifactorial conditions, and this only Varma therapy alone is not sufficient to cure it, and there is no therapies available to cure it. But management we are able to do with the Varma therapy and herbal supplementation, oral supplementation to relieve the symptoms. Many symptoms are relieving, and there are specific Varma therapy protocols are available, and many Siddha doctors are following it. And there are other issues like kids issue, gastric irritability, bowel movements correction, and sleep and muscle tightness and behavioral changes, learning and memory. These all has to be focused. And there are a few great centers in Chennai, like Suabhiman. He is a Siddha doctor. He is using the Siddha, even modern therapies also collectively, integratively he is treating the autism kids. He is the only autistic specialist from the Siddha background. So what my answer is, the Varma therapy alone is not sufficient, but definitely Varma has lot of benefit, in the autistic kids. Initially, you have to doctors will treat, and they will teach the parents also to stimulate some points in the home. Similar way, there are many Siddha doctors, even Coimbatore and Chennai. They do it. They do it in the patients, and they will train the parents to do it. And other internal oral supplements and oilation therapy. There are many other things also necessary, sir.
Okay, thank you. Thank you so much.
Thank you, Doctor. There's a question from Manjunath, Bangalore. He is interested to get training of Siddha and Varma therapy with practicals, but his qualifications is degree of law. So he wants you to give him some suggestions regarding how he can get the trainings. Thank you.
Yeah. So because the Manipal University keeps the basic eligibility as a health people, non-medical people, for them that 1 month course only is eligible. If you just want to learn and get the knowledge about Varman therapy, even you can contact Dr. Kannan Rajaram, who is having the Varma training center at Kanyakumari. He is actually his classes are like monthly 2 days. You can go and learn. He is offering for non Siddha doctors also. So I think that will be the best option, sir.
Thank you very much, Doctor. Do we have any more questions? for Dr. Arul. If we don't have any questions, there's a question from, can we hold a specific session on use of Varmam in anxiety and stress? It's from Clarence.
Yes. So for anxiety and stress, definitely Varma is very helpful because there are specific calm down points are there in the scalp region. And Bala Varmam is one point where people usually keep bindi, pottu, or the dara is applied, and a few other Varma points are there, and some hair oils are there to apply on the specific Varma points. So definitely we are treating patients here, but these need a physical training or physical visit to get this idea. By online, I think it is very difficult to tell this. Definitely, you can contact any Siddha Varma doctors in person. So definitely, they will be able to help you, sir.
Thank you. This is a question from Clarence. And I want to reiterate this point every time we give a webinar. Please don't practice anything on your own. Only reach the health professionals, and only with their guidance. You can do it only for you or your family related people. Please don't practice or don't bring GCSMR into this. Don't get the wrong idea that GCSMR is giving permission to do all the activities. Please kindly have this in your heads, mind, whatever it can be. Only after getting permission from your healthcare professionals, you can do anything, but not to anyone else, only to you or your family. Thank you very much.
I would like to add one point here. As I mentioned, the Varmam is basically reflexology. So if there is a point, there is a Varma point, like pressure Varma points are there. So so if you get a headache, intense headache, there is some intense pain, throbbing pain in some area. They are actually Varma points. So because of some other internal pathology or psychological stress, or because of the migraine, those Varma points, you can experience that throbbing pain. So which means the Varma points can be, triggered by any form. So if you manipulate these Varma points little high pressure, that leads to development of headache. On the other hand, the same point, if you use feather touch, skin touch, and Kalmatare, there is a pressure dependent effect, right? So you can give the benefit. So it is reflexology, and it gives pressure dependent benefit effect or toxic effect, or it can even induce the diseases. That is the thing. So best Varma physician, they don't shake others' hand, because what if other know Varma, and if he can press the Varma points of the hand. So this is how it is. It must not be practiced by the non qualified or people who have not taken proper training. Even to on your own to practice, you need a good knowledge, and please learn it from the Varma therapist or Varma qualified people. Then you can start practicing on your own. To practice on your patient, definitely in your country some legal or guidelines will be there. If you are qualified with the proper degrees, you can practice. Otherwise, it will create a lot of problem to you.
Thank you, Doctor. If there are no more questions, we can wrap up this meeting.
One question is there, Shanti Raja.
Dr.
Yeah, can we cure the disc prolapse or fracture through? Yes, and the disc prolapse is also considered as a some local stress or local pathology of the spine. For that, there are specific Varma spine alignment massage, Tadaval Murai massage technique is there. We are giving that, so the pain will instantly go after that therapy. That therapy requires only 5 minutes. But the pain will come tomorrow, day after tomorrow, which means the channels are temporarily corrected. The energy channels are temporarily corrected. Again, so the patient will be continuously asked to come for that Tadaval Muray or Varma massage every alternate days for some days, then weekly twice, then weekly once, like that. We can reduce the frequency and they will get good improvement. And for this disc prolapse, with the internal medicine, with the Varma Siddha internal medicines, they can get excellent results. In Manipal, we are having a good number of patients for spine disease. And like 1 in 10 patients are only spine disease patients. They are getting excellent results. And only external therapy is not alone sufficient, but 50% of the effect can be given from the external therapy. Varma external therapy alone. With the oral medication, they can get excellent results. And we are having patients who are pain-free, symptom-free for the past 3.5 years. We have been following them. How long the benefit actually, continues even after Varma therapy. So the disc prolapse, disc bulging for spine therapy, we can give very great success using the Siddha Varma therapy. Many Siddha Varma known doctors are having only spine clinic in South Tamil Nadu, Kanyakumari, Chennai. They run only spine clinic because it has a good excellent therapy for the spine diseases.
Thank you, Dr. Arul. Do we have someone is, I think Dr. Shanti Raja is asking about osteo.
For osteoarthritis, madam, if for the osteoarthritis, we have that Puravalayam type, so oil stagnation techniques and a ring bandage type is there that we follow, so that we will immobilize the patella and we will strengthen the muscular thing. If there is a cartilage issue, then we for that thing we have to give oral medicine. Definitely many collagen based supplements we have to give orally, and we have a lot of animal derived products in the Varma therapy, so they will be the supplement, they will be the replacement for our internal organs. So many goat medicines from the goat, medicine from the black chicken, from the crab, so there are many medicines, snail, like that. So they are working wonderfully in these kind of degenerative diseases, because all the time the herbals cannot replace the our damaged parts, but whereas the animals, they have the similar developmental, similar enzymes which is having, and we are using those kind of product. They belong to Varma therapy product, but they are internal medicines. So external Varma therapy, massage therapy, yoga therapy plus oral medicine together we are giving for osteoarthritis. But again, if it is like extreme cartilage degeneration and the extreme narrowed space, then we are helpless. So otherwise, all the patients we can manage with that.
Thank you, doctor. There's another question. Can you provide the MRI scan results for Varma therapy patients before and after therapy?
No, only before therapy, they usually patient come with a scan. So we start treatment based on their pulse. Again, it is important. The nadi itself, we teach the nadi in the nadi examination in this course also. So Siddha has one type of nadi. So Vada Pitta Kapam, if it is high, we have to reduce. Whereas in the Varma talks about less nadi. If Vada is less, Pitam is less, Kapham is less, how much less, where, which right or left side. Based on that, we will be able to know there is a Varma impact or not. So to elevate the nadi, so there are medicine, Varma medicine. So it is like people should have both Siddha and Varma, both knowledge they should have to understand this nadi concept. Then we choose the medicine, once treat them. Every 15 days when they come, we check pulse. If the pulse is changing, we change the medicine according to the pulse. So this is how medicine is given. After like 2 to 3 months later, patient will be all right, and when they become symptom free, we don't ask them to repeat the MRI. But a few patients who have Medicare facility, who have that concession Medicare facility, they themselves performed the MRI and shown the result to us. And those patients we are following how long they are symptom free, like that. So otherwise, every patient need not to repeat the MRI. Even MRIs are not required at all in many patients, because clinicians can make out is it a L3, L4, L5, or S1 where is the pathology based on the, that innervation to the lower limb or in the shoulder. Best clinician can make out. So always MRIs are not mandatory to treat the Varma and Siddha therapies.
Thank you, Dr. Arul. There's another question from Clarence. He's asking any recommendation about the centers or certified practitioners in and around Hyderabad.
I'm not sure in Hyderabad, but in Tirupati, Devasthana, they have one medical college. So Tirupati Medical College, in that one Varma department, Siddha department is there, run by Ayush Ministry. Other than that, I am not sure any other best, I can recommend or not. I don't know, because very less people are. I don't know anybody's there who are qualified, learned this Varma therapy. But few Vaidyas are there, they are practicing in Hyderabad, I know. But few people have applied for this course also this time. So at present, I am not able to recommend anybody except that Tirupati Medical College. They have the Siddha department, full-fledged department run by Ministry of Ayush. And you can approach them, they will be doing the Varma therapy.
Thank you, Doctor. We just have time for only a couple of questions. So we can wrap up if there's no questions. If anyone has any questions, please raise your hands or send us a chat. Okay, if there's no questions, we would like to wrap up this meeting. Hope you all got the information that you need. Please send us any questions, or if you have any request, send us an email to gcsmr20@gmail.com. We will answer your questions right away. And also, I want to thank everyone who joined this meeting and Dr. Arul for taking his time to give us such an elaborate explanation about Varma therapy. I'm even, I know I'm curious to take the course, but I'm only a PhD scientist, so I don't know how far this will help. But anyway, hope you all can share this information to any of your health professional friends. Maybe even your kids are doing some medical courses. So please share this information. We still have time until the end of February to register for this course. Yeah, and again, I thank everyone for taking your time to join this meeting. If there's nothing, Tamarai, do you have anything? We can wrap up.
Thank you, Rama. Thanks for the wonderful introduction and all the program went. Hope it's useful for everyone. As Dr. Rama told, please forward this message to everyone who are in the health professionals who are planning to take this Varma course, India or in US. And also, I think the deadline has extended up to February 20th, I think. So it's a great opportunity. If we have more registration coming, Manipal University may also consider opening another session. So it's in our hands now. So let's encourage and spread this message to all your known contacts. Please stay tuned with us. We have a WhatsApp group in each cities, and Charlotte, we have a WhatsApp group for GCSMR. You can contact me anytime or at gcsmr20@gmail.com. Go to our website. I think Rama has posted our website in the chat. Go to our website. We have all this information in our website. Go to the Mahi and you can see all the information about this course and online courses, how to get inside, the links for that. Everything is there in the website, so you can go there and find all those information. So stay tuned with us with the next webinar on any health topics. Thank you all for joining today. Thank you.
I would like to add, we host several webinars and meetings. So if you guys are interested in any particular topic that where you think might be interesting, please email us at gcsmr20@gmail.com. And we can even connect you to the WhatsApp groups. So only if you send us your information, we can add you to the particular groups. I'm sure there are several groups, even in California. There's a group. There's here in Charlotte, and we have a general group. So if you send us your contact information, we can add you. And visit our website. There's a wealth of information in there. And finally, I always say that we are a nonprofit, and any donations is accepted, and it will be very helpful. Even a little bit goes a long way. So thank you very much. I appreciate all your time, and stay tuned for more webinars. Please contact us, and we look forward to seeing you all again soon. Thank you very much.